So I want to take a quick moment and talk about something near and dear to my heart, prostate cancer. All right. First of all, prostate cancer is the second most common non-cutaneous, meaning non-skin cancer of American men. And the fact of the matter is, for the vast majority of patients that are diagnosed with prostate cancer, you are more likely to die of something else, like heart disease. So I wanted to let you know that it's not, the end of anything, and that includes the end of your sex life after treatment. There's a lot of options available to help with ED after prostate cancer treatment, a lot of resources available, and just like I talk to your urologist about your ED, talk to your partner about your ED after prostate cancer treatment. And if you aren't yet old enough and haven't been screened, can't officially say you should at age 50 or 55, but you should at least discuss it with your doctor. And prostate cancer screening, you don't need to be afraid. It's a combination of a blood test and an internal exam. It's not that bad, and it can save your life. So just go do it. And prostate cancer treatment is not the end of your sex life. It's not the end of your marriage. These aspects of its management, of the disease management, can be treated, they can be managed.
And I would imagine with screenings would be early detection, and then you could get ahead of some of these problems down the road.
Typically, that's correct, although after you're treated is when a lot of these issues tend to come up and rear their ugly head the most.
Gotcha.
Okay. How does an enlarged prostate contribute to ED?
Well, just like prostate cancer, it doesn't per se, but often the treatment of enlarged prostate symptoms, going too often, having a weakened stream, not emptying all the way, those kind of subjective urinary symptoms. The drugs or the treatments used for it, for instance, finasteride, a drug that's used to shrink the prostate, as well as it's also a balding medication, can actually decrease the level of a special metabolite of testosterone called dihydrotestosterone that's very important for libido and arousal. Other treatments for we call BPH, or benign non-cancerous prostate enlargement, include something like a TURP, or a transurethral resection of the prostate. This is an endoscopic surgery where the prostate's extra tissue is cored out so that there's more, the lumen, or the opening of the urethra, is wider to allow more urine flow. In the process of this, there's typically some thermal damage to nerves that overlie the prostate. These are the nerves not for sensation, but the nerves that help to stop that venous outflow that allows the penis to then rise hydraulically in the face of arterial inflow.
So how can somebody work on their prostate health?
Simple thing you can do is just ejaculate more often. Studies have shown that men who ejaculate more often have a lower incidence of prostate cancer.